Rand Paul goes after the fired CDC freak shows, saying there is no medical reason in response to this guy who just got obliterated out of the CDC, rightfully so. I don't even know what took so long. But he's responding to him. He's saying, you know what? There is no medical reason from Rand Paul, a doctor, to give newborns the Hep B vaccine if the mother is not infected. All mothers who deliver in a hospital are tested. This scientist's so-called, quotes, fetish for vaccines is not supported by the data. Rand Paul's a doctor, and this is not medical advice. Consult your doctor, but we like Rand and trust him. Chief Nerd is also sharing this. Okay, this is the clip of this fella, and if you remember, sorry to do this, but it's true. This guy was in the government. Here is, it was posted from Will Kane. This fella says pentagrams, harnesses, the belief that men can get pregnant. This guy's gone from the CDC. Yeah, we think medicine's a little bit better off today than it has been. And now he's gone. But now he puts on a suit and he's like, no, like I'm a real sophisticated person here and I want to talk about jabs.
I mean, from my vantage point as a doctor who's taken the Hippocratic Oath, I only see harm coming. I may be wrong, but based on what I'm seeing, based on what I've heard with the new members of the Advisory Committee for Immunization Practices, or ACIP, they're really moving in an ideologic direction where they want to see the undoing of vaccination. They do want to see the undoing of mRNA vaccination. They have a very specific target on COVID, but I do fear that they have other things that they are going to be working on. Hepatitis B vaccine is on the agenda for the meeting in September. I predict that what they're going to do is try to change the birth dose of hepatitis B vaccine so that kids don't get it when they're born. So if you have a mother who is well connected to care, you know her hepatitis B status, that may not matter very much. But if you have a mother who's not gone to prenatal care, who comes in to deliver, we have one bite at that apple so that child gets that important hepatitis B vaccine.
And they want, man, as soon as that baby comes out, like, put it in there, vitamin K, whatever. Here, you need it. Yeah. Shove stuff into your newborn. Rand Paul says, that's not scientists' analysis. This is a fetish for vaccines. And we know he's already got other fetishes.